We're just going to get started in about 20 seconds. We're just letting people log in. Okay, we'll get started. Hi, everyone, and welcome to the ALD Connect Bootcamp for symptomatic women with ALD. My name is Jessie Torrey, and on behalf of ALD Connect, would like to thank you for participating in this session on coping with your ALD diagnosis and symptoms. Today, we are joined by two patients, JoAnn Locy and Julie Chu, who will share some of their experiences dealing with their own ALD diagnosis. We're also lucky to be joined by Dr. Deborah Renaud, a neurologist and medical geneticist from Mayo Clinic in Minnesota, who will discuss, among other things, her findings from her recent natural history study of men and women with ALD. Please note that this webinar is for informational purposes only. The discussion is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you or a family member are ill or suspect that you are ill, seek medical attention immediately. ALD Connect does not recommend or endorse any specific physicians, treatments, procedures, or products, even though they may be mentioned in this webinar. Any questions can be submitted in the chat, and at the end, I will help share them. And JoAnn, we are going to start with you. Thank you.
Okay. Thank you, Jessie. Hello. I am so happy to have been asked to speak today. And I have typed up my talk because I wasn't sure where I would be headed. I was diagnosed with ALD in my mid-40s, and I'm 62 now. I went from using a cane as my balance started wavering to being in a wheelchair full-time today. Since the beginning, I'd lost most of the sensation in my legs and have no pain like so many of our ALD sisters do. I've had occasional bouts with neuropathy, but nothing that stayed around. While I'm glad I don't experience the pain, I have to be very careful of injury because I can't feel much, often not realizing that I have been injured. And oh gosh, toes are the worst. They bleed like crazy. Keeping the Band-Aid people working. Over the years, I've experienced lots of troubles with my bladder, some with my bowels. I started with a few accidents and using a thin incontinence pad to where I have literally went through all layers of my clothing while wearing the most advanced pads, sometimes changing clothes 2 or 3 times a day. Thankfully, that's not every day. I've been given 3 options so far: self-catheterizing, surgery, or I can set a timer to make sure I get into the bathroom every 45 to 60 minutes. I've shed many tears looking at these options online. Major troubles can happen, and the best advice I can give overall is to listen to what your body is telling you. Learn to work with this disease to find ways to make symptoms tolerable. And for you, one thing that works for somebody else may not work for you at all. And I'm sure many of you are thinking, what the heck is she talking about? But our bodies will tell us when we're pushing too much, when we need to start doing one thing or stop doing another. They'll tell us when we need to sit and rest. By mid-afternoon every day, I take a nap. In as little as 10 minutes, my brain fog can clear and I can take on whatever comes after that. And yes, sometimes the naps last an hour. I found that it's really important to build a team of doctors that are willing to work with you. But I choose to be grateful for every day and what comes my way. Some of the doctors join my team because I have chosen to be part of the process of living. I have down times and I get frustrated, sometimes even mad as hell. Acknowledging how I feel goes a long way, and most times the feelings smooth themselves out eventually. It's not that I forget about them. I work with them and learn what works best for me. I definitely get thrown for a loop at times, but then I have to decide to sit up straight in my wheelchair and move forward. There are too many great things in life to be a part of. I do have a list of professionals that I asked for, of people in my area to talk to in case whatever I'm doing isn't working. And they all have specialized working with people that have chronic difficulties. So that's something that you might want to consider, getting yourself a list. My shoulders are messed up from the years of cane and crutch use. My hands have arthritis from the same reason. My orthopedic doctors won't do surgery, as I just can't be without my ability to transfer and hold myself up. Finding exercises to work through every day does wonders. Topical creams also help when the going gets tough. We were able to buy a conversion van that gets me everywhere I want or need to be. With the power chair, I can get in and out by myself. Not much stands in my way if I want to get out. Contact the local conversion van distributors and get on their waiting list for used vans. They come and they go quickly, but if you want one and if it'll make a difference in your life, it's the best way to do it. I volunteer outside of the house as a director for the local food pantry. I go there and spend time every day and keep up with everything that's going on and making sure everybody has the answers that they need. I ask that you acknowledge your need for people to share your life and act on that. I maintain solid relationships with friends, and we meet often for breakfast or lunch. If I'm not having the best of days, they'll even come to my home just to visit. Share what's happening with family and friends. Don't expect them to solve the problems. Just sharing them can ease a lot of troubles. That all being said, and some not shared, every day is a blessing. We all have that choice. It's up to us to grab a hold of it or to let it go. Thank you all for listening.
I want to thank you on behalf of everyone, and a special personal thank you as a woman with ALD myself. You are an inspiration, truly. Julie would love to hear your story. I think you're muted. Sorry.
Okay, I'm unmuted, right?
Yes.
Yes, thanks, Jesse. And yeah, I just like JoAnn, I'm very happy here to be asked to share my story here. I love this community. I'm so grateful that the community is here and can provide some advice when you're needed, and or just a place where you can go to when, well, really there is nowhere else to go a lot of times. But in any case, I was diagnosed about 10 years ago. I'm at the age of 46, so now I'm 56. And my brother also was diagnosed at the same time, and he had already been having difficulties for like 10 years without being diagnosed. So it was really tough with that. I am ambulatory. I can walk around on my own. I did start using a cane starting last year. That was during the pandemic, being that I wasn't able to get sufficient exercise, getting outside of the house, etc. And so walking, my balance had gotten much worse. And so that's a thing that I'm going through now. But at the same time, I do believe in exercise, the healthy diet. That I strongly believe that that's helped a lot. Just staying with whole foods, staying away from processed, foods that, the easy to cook, frozen, pop it in the oven kind of meals, those are gone. It's so much better to have your own food, to cook your own food, and you know what ingredients are in there. I've had physical therapy by a physical therapist who specializes with MS patients. So that helped greatly. So I believe someone mentioned it in one of the other panels, and they helped me a lot, especially early on. If so, early on, get the help that you need, because that will set you for going forward. That's whether it's bad or good or what have you. I still work full time, so I come across colleagues at work. Well, okay, so right now we're not back to work fully, but slowly we're going back to work, and I've met colleagues, and they're all surprised that now I'm walking with a cane, but everybody's supportive, because ALD doesn't define me. I'm still me. It's just I'm dealing with it, coping with it the way I am, and still able to socialize, to work with my colleagues. So there are some restrictions, but I'm still able to function right now, and that helps a lot. I commute when I go out. I'm in New York City, so I commute by public transportation. So I am meeting all kinds of people who they see the cane. I have some struggling sometimes, and I am met by so many people who want to help. They all just want to help. They just, can we open the door for you? Can we reach that for you? That's a blessing. I've never used that word before, but yeah, I feel blessed that there are so many helpful people who just want to help. That's such a great feeling. And so that helps me, because you get to smile, you get to say, oh, thank you. You actually communicating with people, strangers. You don't know who they are, they don't know you, but it helps you in your day. I find that really helpful, and that's new for me too. Being in New York City, I'm in a big city, so people don't take the time to talk to each other. So it's different for me. So I appreciate it. So the last thought I want to say is there's a certain acceptance of what you have, and you just know that your life is not going to go back to the way it was before, and you just have to cope with what's in front of you. Listen to the news, attend the boot camps and the meetings, and find out what's working for people, maybe it works for you, what medications there are, what other alternative therapies they may be, and so forth. And that's where I am, and that's what I have to say.
Again, Julie, I'm at awe at your honesty and your attitude. It really, I applaud you for that. So thank you so much for sharing your story.
Thank you. I hope it helps someone.
You've already helped one person here, and I have a feeling there are dozens more that are listening to your story and finding strength. And I love particularly what you said, that ALD does not define you. And I'm going to use that line at least 20 times today and forever. Thank you. Dr. Renaud, did I say your name right? I sure hope I did. I would like to introduce you. Oh, you're muted. There.
Perfect. That was right. Yep.
Oh, good, good. We are looking forward to getting some expert advice. Thank you.
Okay, let me share my screen so I can show you some of the data from the survey as well. All right, here we go. Okay, so, I mean, it doesn't come as news to anyone here that women with ALD have symptoms. Now, of course, if we'd have looked at the literature 20 years ago, it would have said that only men get symptoms. We all know that's not so. And in fact, you know, approximately 40 to 50% of males when they're born are destined to get an adult onset form of the disease with the characteristics of adrenomyeloneuropathy. But more recent studies would suggest that that's up to at least 65% of females will become symptomatic with ALD. And you notice I don't use the term carrier there. And the term carrier for X-linked conditions, X-linked adrenoleukodystrophy, Duchenne muscular dystrophy, et cetera, is no longer an accepted term really in the genetic community, because we know that women do develop symptoms of X-linked conditions. And I use the term still adrenomyeloneuropathy for symptomatic men and women for a couple of reasons. And we use that term in our survey because, first of all, it describes very nicely the symptoms. So adreno for adrenal insufficiency, myelo for the spinal cord symptoms, such as spasticity and bowel and bladder dysfunction, and neuropathy for the numbness and pain and weakness that you get from neuropathy. And the other reason I use that term is because clinicians understand the term adrenomyeloneuropathy because it's historically been used for the men. But let's face it, women have the same symptoms. And if we can get physicians to understand that the symptoms are the same, then the treatments will be offered that women deserve. Sort of puts us on an equal footing, you know, for the women and the men with clinicians. And so I still do like to use the term AMN for symptomatic men and women. Thankfully, the cerebral form of ALD is very rare in women. And adrenal insufficiency, although much less common, still occurs in 2 to 3% of women. And if a woman has adrenal insufficiency, it is just as potentially deadly as it is in men if you get an illness and you don't recognize that you have adrenal insufficiency. And so I think it's critical that clinicians screen women for their adrenal insufficiency. Let's face it, if you're exhausted because you have adrenal insufficiency and it's gone undetected, then that affects your ability to get through your day and to cope with your other symptoms. And although the literature states that AMN in women is milder and occurs at a later age, we know now that's not true, don't we? We know that there's much more variability in age of onset and of severity in both men and women. There are women that are much more severely affected than men at the same age. And so I think one thing is that we need to improve the understanding of clinicians and awareness so that they treat women the same as men. And what kind of symptoms affect daily living? Well, there's the progressive stiffness and weakness in the legs and changes in walking, the need for assistive devices, and as JoAnn and Julie discussed, there's the imbalance because of the numbness and loss of sense of position that causes falls. There's the spinal cord dysfunction that results in the neurogenic bladder and bowel, which cannot, has never been really very well emphasized in the literature until very recently. But let's face it, having a neurogenic bladder or bowel affects our daily ability to cope, doesn't it? I mean, if you can't make it to the bathroom on time at work, it's embarrassing. And, I think that we need to emphasize issues related to the bladder and bowel more. Peripheral neuropathy can result in pain, chronic pain, and it needs to be treated as a medical type of pain. I think that a lot of people get told, oh, well, you just need to cope with that. It's not a real symptom, and it is. It can be very severe, and I'll show you some data that suggests that women actually suffer more pain than men. There's poor sleep and fatigue, which seems to be an intrinsic part of AMN, and there's early hair loss, which can be experienced by women as well as by men, which is treatable. And but very few men or women that I've encountered with early hair loss have been referred for treatment of their hair loss. That's part of our clinic. We have a dermatologist who treats hair loss that is willing to see our patients, but most people have said nobody's ever addressed that with them. And I think it's something that's more significant for women than men because, men get hair loss. I mean, it's part of being a man, I think, but for women, it's a very difficult thing emotionally than it is for the guys. And in addition to the stress and burden related to symptoms, women have extra burdens. I mean, I have women tell me on a regular basis, they feel guilty that they passed ALD on to their sons. And there's nothing you did or could have done differently, and you shouldn't feel guilty. We all carry mutations in genes that are clinically significant. And a good example of that is cystic fibrosis. And I can tell you that's one of the 20 things that I carry being French Canadian. And I have cousins on both sides of my family who have died of cystic fibrosis. But remember, there's nothing that you can do, and you should not feel guilty about the fact that you have a son with ALD. And I think that a lot of women will worry more about their family members and not prioritize their own health. I have families come to our clinic where it's a symptomatic female and their son, and they've only made an appointment for their son that's being screened for the cerebral form and not for their own symptoms. And it's time that women with ALD prioritize their own health as well, because you guys are important caregivers for your family. And I think that medical providers really don't understand that women with ALD have the same symptoms that men do, but their treatment is often delayed or it's inadequate because women are being told, well, your neurogenic bladder is because you had babies, or, oh, you think you have symptoms, but it's anxiety, it's not really a medical symptom. And I hear this from women all of the time, and it's just not acceptable in 2021, really. So let me tell you a bit more about some of the data from the survey. And interestingly, you can see that almost 3 times as many women filled in the survey. And I had women email me and say, thank you for giving us a voice. So I think that was why we had so many women fill in the survey, about 84 men and 214 women. And women who completed the survey did tend to be a little bit older than the men, as you can see. But there is, quite a distribution of men and women. There was a significant difference here, though, in the overall age distribution. Women were more likely to be diagnosed because of a family member instead of their own symptoms. And so you can see that even though women had symptoms, if they didn't have a family history, physicians were not testing them for AMN, for ALD. They were not being tested. Men were more likely to be tested for their symptoms. If they had a family member, then they were more likely to get tested for ALD because of their symptoms. And obviously we knew that some of the women were asymptomatic and then became symptomatic. But I think we need to increase awareness that especially amongst multiple sclerosis clinics, that women should be tested for ALD as well as the men, because I know our MS clinic, when I first spoke to them, said that they were only testing men for ALD, not women, which was interesting. Men were more likely to be single, never married than women, by quite a significant amount. You can see 31% versus 8%. And there was a trend towards more women being retired and more men being on disability at the time of the survey. From a neurology point of view, women were more likely to have pain and burning in their feet. And so 56% of women and 39% of men. Numbness was actually more common in men with neuropathy than women. And men were more likely to have experienced falls, needing assistance with walking, having changes in their gait earlier than the women, and having hearing loss. Cognitive changes, interestingly, remember, there was a question saying that if you had, if you had cerebral ALD, then you were expected to not complete the survey. So these are all individuals who do not technically have cerebral ALD, but yet cognitive changes were seen in 32% of men and 42.5% of women said, yes, I've experienced cognitive changes. And when we dug down into the data, it looked like people who had cognitive changes were more likely to have sleep problems. And I'm going to get back to that because it's pretty relevant, and more likely to rate their overall health as poor. So those who rated their overall health as poor, so 0 to 4 out of 10, had more neurological symptoms. Not only were they more likely to have neurological symptoms, but they had more of them. They had more sleep problems. They had more bowel and bladder problems. Okay. Women were more likely than men to have been treated for depression. So 52% of women and 27% of men said that they had been treated for depression or anxiety. Now, this does not include people who have depression and anxiety and they're not being treated, right? And we all know that having depression makes it a lot harder to cope for things in general. And so 81% of women accounted for 81% of the people who said that they'd been treated for depression. And this actually was more than the general population, the number of people who said that they'd been treated for depression and anxiety. And overall, of course, not surprisingly, those who had a depression and anxiety rated their health, were more likely to rate their health as poor. So it's sort of these things all tie together. Interestingly, they were also more likely to be middle-aged at the time of completing the survey. And I don't know if that's because that was a greater percentage of the individuals, or whether it has something to do with, early on, we're all kind of way more optimistic maybe. And then later on, maybe we're more accepting of sort of our state of well-being, whereas in middle age is a time when we're all battling with that. I have a career and I have family to take care of, and it's harder to cope. I'm not sure, I'm not sure. We couldn't really flesh out whether that was significant. Now, this is very interesting because overall, those with depression and anxiety were more likely to have a sleep disturbance. 90% of women versus the men said, sorry, 90% of people with depression said they had a sleep disturbance. 75% of the rest of the group also said they had a sleep disturbance. And we all know how difficult it is to cope when we're tired and how difficult it is to get through the day. And so I think this is very significant, and it's something that we had noticed in the clinic as well. And as in particular, restless leg symptoms. So 70% had restless leg syndrome symptoms on the survey. And we've found this as well in our clinic, which is why we screen all patients for ferritin. Now, maybe this is the first time any of you are hearing the term ferritin. Ferritin is actually the iron storage protein. And when this is below 35, and for some individuals below 50, you can have restless leg symptoms from this that significantly disrupt sleep, where you have to move your legs around in the evening, your legs are kicking as you're trying to fall asleep, you're having frequent wakings at night because of the movements of your legs, and you're not rested in the morning. And if the ferritin is low, sometimes just treating with an iron supplement will improve sleep. And so I think this is a very significant thing with regards to coping. I know it's not directly in some ways related to ALD, but it's definitely something that we've observed and clearly comes through in the survey. The amazing thing is that only about 16% of people who said they had a sleep disturbance had ever seen a sleep specialist or had ever had a sleep study. So this is an undertreated symptom by far. When we looked at specific symptoms, so we said during the past 6 months, how often have you been bothered by any of the following? You can see that there are many symptoms here that indicate that men and women actually with AMN are not coping well, and that there are interventions that are needed. Because when we looked at, well, what percentage have actually, been seeing somebody or to help them with their coping, it's much lower than it should be. But you can see worrying about their own health, 70 out of 176 people who responded, so almost half. Some were experiencing financial problems, stress of taking care of family members, stress at work. Again, 75 are having at least some stress at work. Feeling a need, having no one to turn to, or feeling isolated. This is an incredibly high number. There we go. Half of individuals said that they don't feel that they have someone to turn to. And so I think that from a coping point of view, if you don't have a family member or friend, I think it's important to search for a professional person to turn to talk about difficulties that you're having coping with your symptoms of ALD. But some people are saying that they're even having trouble concentrating on things like reading a book or watching TV, things that should be enjoyable. That's actually a symptom of depression. So don't not pay attention to that. It seems trivial. I mean, especially in the summer when there's literally nothing on TV except thankfully some Olympics right now. But when you're not able to concentrate on things that you should enjoy, then that's a concern. If you're not having pleasure doing things. And so I think that one thing that really came through in the survey is that men and women with AMN are not coping as well as they need to. And to be honest, when you're tired and sad and having trouble coping, it makes all of the symptoms worse. It makes it harder to control pain. It makes it harder to get through the day. And so, I would urge everyone to be mindful of that. And yet, although the medical literature focuses so much on neurological symptoms, quality of life is actually determined by many more things, not just the neurological symptoms, but also the endocrine issues, the bowel-related issues, and the bladder-related issues. And depression, anxiety, and sleep disturbances are common. And we need to be including this in our multidisciplinary care for symptomatic women with ALD and for men and women with AMN. And so now I'm going to unshare because I think we can have a discussion now.
Thank you so much information, and I see many questions coming in.
Oh.
So I am going to read some of them out. Several people were asking about hair loss. It's not been something discussed often, and it sounds like you have some wonderful ideas about treatment.
Yes, I mean, some of our dermatologists are specialized in hair loss. As you can imagine, we have kind of somebody specialized in almost everything at the Mayo Clinic. So there's actually a hair loss clinic, and we've had some women start with just something as simple as Rogaine foam. That has been helpful. And then there's a variety of other things that they use. I mean, basically anything that can be used for male pattern baldness can be used for hair loss in symptomatic women with ALD. And so most dermatologists should be able to see you for that symptom, really.
Thank you. I think it's probably often a symptom that women are putting on the back burner, but I'm sure they'll find that helpful.
I was going to say anything that makes you feel self-conscious, though, is something worth addressing, because I think the one thing that we decided early on when several of us met to make our protocols for our AMN and ALD clinics was the importance of treating patients as people and individuals, and trying to look at them as an entire person instead of just someone with a neurological problem or a urological problem or whatever, but to sort of look at them as, well, what are all of the things that could actually be contributing to poor quality of life?
I think it's huge. And as you said throughout, mental health is so connected to how we keep up these wonderful attitudes like JoAnn and Julie. So anything to help you feel better about yourself, I think it's important. There's several questions about thyroid problems.
Yes. Oh, I didn't mention that because I was trying to keep it down to 15 minutes and I cut out a lot of the endocrine, neurological and all of that. Because like I said, there's actually an incredible amount of data, but we've been now screening for hypothyroidism because we've observed, and interestingly also in the survey, the rate of hypothyroidism is greater than the general population. And so what we don't know, because I couldn't find a single pathological study on this, but could very long chain fatty acids be accumulating in the thyroid? It is a solid organ. We know that although it's almost completely not discussed in the literature, that they do accumulate in testicles and that some men could be at risk of testicular failure. There's no studies at all on ovaries, so we don't know whether it could affect ovaries. There's no studies on thyroid. But when you're getting tested for your adrenal insufficiency, I'd ask to get tested for hypothyroidism at the same time. So that's a great question. I took that slide out at the last minute. Sorry about that.
No, I'm glad it was asked, and I'm glad you gave such a thoughtful answer.
Well, and of course, you're going to feel tired and all of that. And it has some similar symptoms to adrenal insufficiency. So important to do the two together for sure.
Absolutely. There was somebody mentioned that a doctor had told them that their neuropathy had nothing to do with ALD, but it seems from what you've shared that might have been wrong.
Well, it sounds like a lack of awareness on the part of the medical provider, and that's why I say that I still like using the term AMN for the two reasons. One is that if you say, when I say I'm referring a woman with AMN to one of my providers, they initiate the protocol for, okay, what do I do for that disorder? And they don't seem to pay attention anymore to the whole X-linked thing, which has been very helpful, because then I think the men and women get treated the same, which is what we want. The other thing is, of course, that the term AMN is recognized as an ICD-10 code that insurance companies will automatically then cover a wide range of things for that. So once you code somebody as having AMN, so that's what I use as a primary diagnosis for all women, because then it automatically is something that will include, an MRI if we need it, and an EMG, and et cetera, all urology and all those things should get covered when you use that billing code, because it's a recognized code. You see what I mean? Whereas if you
do.
do something
Wonderful
else,
you're
you may
sharing
not get full coverage for the things that you need. But I think that the awareness is critical, and I'm hoping that when our survey gets published later this year, it's a massive paper, but I'm hoping that providers will read it. We're thinking of actually doing one more for primary care providers. It's sort of toned down a bit, that basically says, what do you do if you have a patient with ALD? Like more on a really kind of basic practical sort of level as well, so that they have a reference. So, but I'm sad to hear that, like you say, that so many providers don't understand that the bladder problems are part of ALD and the neuropathy is part of ALD. And the imbalance.
Thank you for mentioning the coding of AMN. That's such a valuable way of making sure that we're taken seriously and able to do the testing required. Somebody would like to know if you see adults, women with ALD yourself.
Yes,
Sure,
yes, I do. Yeah, no, our multidisciplinary program is actually from newborn screening and all the way up to adults with men and for both men and women. So I see all ages, and then I have a pediatric team and an adult team. And we're currently in the process of actually getting providers. Sorry, I didn't mean to do that with my eyes. The severe storm just started hitting the window again. We're having some hail here. Sorry, guys. To have availability for the ongoing care in Jacksonville, Arizona, and there's a place called Mankato that in the Mayo Clinic Health System, so that a lot of the urology and other ongoing care can occur at sites closer to patients, with me videoing in as the specialist. But the main program is in Rochester, Minnesota right now.
That's wonderful. Somebody said that they were having lab work done for the ferritin levels.
Yeah, I see that. And so, and it was high. So a small percentage of the population do also have something called hemochromatosis, or you can be a carrier. That's one where if you have two mistakes, then you have the disease hemochromatosis. If you have one mistake, then you're a carrier for hemochromatosis, and you can have a mildly elevated ferritin and iron. And if you have the full disease, and the ferritin and iron is very high, and you shouldn't take an iron supplement for that. So don't just take an iron supplement. This is an amazing point. Thank you very much. Because you shouldn't just take an iron supplement without getting it measured first. Okay, don't just say, oh, I have restless legs, I'd better take an iron supplement. Because if trying to see who it was that put that in here. Janice, oh, okay. So like Janice, if you were to start iron, that would cause a problem. So if you're having restless leg symptoms, ask your primary care provider to measure the ferritin for you. And if it's under 35 for sure, and potentially even under 50, it may be worth them prescribing you an iron supplement. But if it's high, you should not. Great, thanks, Janice.
I don't see any other questions. I wondered if ALD Connect had any specific questions?
Oh, here's one. So yes, so it says, do you recommend that women with ALD do blood testing for adrenal insufficiency and thyroid testing? Yes. Symptomatic or not? Both. So we do annual, I think you should do it annually, testing for adrenal insufficiency and the thyroid annually. Through your primary care provider is fine to do, but remember that adrenal insufficiency is completely independent of neurological symptoms. So you can have adrenal insufficiency alone. So yes, absolutely. Let's see.
Do you do online consultations?
Do you mean like video consultation?
I guess so, yes.
Um,
You may need to start.
it sometimes, yeah, to start off. Now I'm hesitating just because the rules keep changing for telehealth. And so I think that ours are changing soon, but if you email me, I can determine whether or not, depending on where you're located and all of that. It's partly a licensing thing, let's see. Fatigue. It says, so fatigue has to do both with your AMN symptoms and lack of sleep, and potentially also depression in many, yes. And now there's a question for Julie and JoAnn. So
Can you pinpoint any one or two things that have been most important to maintaining your happiness and optimism in the face of ALD?
I think just reminding yourself and looking for things that make you happy. That's really a very simple thing, but looking outside today, I had a bush that was covered with monarch butterflies, and oh my gosh, they were basically extinct. And now they're coming back, and I'm so glad that something in my yard is really supporting them. But you just have to really kind of look for those things that are going to make you feel good.
Yeah, I agree with that. I agree. It's, there are some things that, you still want in your life. You're not going to just get rid of them,
Mhm.
For me, it's not butterflies, but I don't know, just different things, like different hobbies maybe, and, catching a really good movie, having a nice chat with a friend on the phone, is simple as that. It's just so nice, and grateful for your family and their help. There are struggles, but it's not so overwhelming that I can't get out of bed, that kind of thing. So
Right. Yeah, you've really got to find your happiness. And as you said, Julie, it's having the people around you making so much difference in your life, and just choosing the things that always made you feel good, or, it's it can be real simple, but it can be real tough to do.
well, and like you said, Julie, don't let ALD define you.
Right.
Absolutely.
We're still us. They're just, we're dealing with an extra thing. That's all. It's another thing in our lives.
Well,
Very
I
true.
think hearing that is going to help a lot of people. We thank you so much for that. And we're just about a minute earlier. Are there any last minute things either of you would like to share?
No.
Otherwise, I'm going to thank you all so much for your honesty And it was a wonderful, wonderful panel, full of optimism and information, the best of both worlds. So
Thank you so much.
all, and the seminar will continue in about 5 minutes. So we'll see
Great.
you all.
Thank
Bye,
you.
everybody.
Thank
Bye,
you.
everybody.
Bye.
Bye-bye.